like to reassure you that at University College Hospital we take patient safety of utmost priority.
We've worked really closely with our infection control colleagues in the hospital and also our virology consultants to make sure that what we're doing is the right thing for you.
Before your procedure, you will be called by one of the endoscopy nurses to ensure that you've received your appointment letter, that you understand the procedure, that you have your medication to hand, and if you're having a lower GI procedure, that your bowel preparation has been received and you know how to take that.
And are you currently suffering from any symptoms of COVID?
You will be invited to come for a COVID swab and then be asked to self-isolate prior to the appointment.
And you can confirm to me that you will attend a COVID swab test?
Our staff are regularly tested as well. So I was tested on Friday, just gone. So we have that in place just to reassure us that the processes that we've got in place protect our staff as well as our patients.
Due to the pandemic, we have reduced the number of people that are allowed in the hospital at any one time, and we ask escorts and relatives to not attend with the patient unless under special circumstances. When you arrive at the endoscopy unit, the first thing you'll notice is the chairs are socially distanced and spaced out. You'll notice that the reception area has a perspex screen. All staff are asked to wear masks and we'll be asking you to wear a mask as well. The receptionist will check you in. You will be asked to use the hand sanitizer, then they'll ask you to sit in the reception area. The admission nurse will call you from the waiting area and take you into the admission lounge.
The nurse will check your temperature and ask you some more questions, some of them related to COVID, but most of them actually related to your procedure and the types of questions that we would ask you when you come in to make sure that you're fit for the procedure, but also to give you the opportunity to have a chat with us and try and allay any fears that you've got and make sure that you're fully prepped for the procedure and you know what's going to happen.
Our procedures are spaced out, so there is time for the procedure room to be cleaned, to be sterilised, and for the airflow to improve before the next procedure happens.
The big difference that you'd notice if you have been into hospital before is the amount of PPE, the protective equipment that the staff are wearing. So a majority of the staff you'll see will have a mask and a visor and an apron on, but you may find that some of the staff in the room have a much more sort of sophisticated mask.
We appreciate actually that sometimes you may not be able to hear us as clearly through the mask, so we are encouraging all our staff to talk a little bit louder and clearer, and if you don't hear anything, please let us know and we'll speak again. And all of this is really there to minimise the risk of transmission, and in addition to swabbing patients beforehand, we're really confident that this is a really good way of keeping our endoscopy workload moving forward and getting patients the diagnostic test that they need in a timely manner.